patient before surgery will go and get a CT scan of their hip or their knee, whichever joint we're replacing. And before the surgery, I sit down and I go through the plan. With the CT scan, we can make a three-dimensional model of what that patient's hip or knee looks like. And so we know exactly where we need to put the different components of that joint replacement. The robot only works within the parameters that we allow it to. And we use it to make the cuts that we normally would by hand. It takes the guesswork out of it because the robot knows exactly where that patient is in space based off of the CT scan. We're looking at a screen and it's showing us where we're making the cuts. So that means we can do better, more reliable surgery through a smaller incision and less soft tissue disruption, which means for the patient, decreased pain.